House Bill 2809. Imagine this. A foster child in Texas attempts suicide and is rushed to the hospital. The Department of Family and Protective Services is required to report deaths in its care, but until now, there's been no requirement to track suicide attempts. What the bill says it does? House Bill 2809 tells DFPS to start counting and publicly reporting suicide attempts among kids in foster care. It also requires the agency to notify caregivers or parents when an attempt happens. What it actually does? Instead of DFPS collecting data directly, the bill lets them rely on Medicaid claims through the Health and Human Services Commission. It moves the report deadline from February to December, meaning lawmakers and the public see the numbers months later. DFPS must handle it all within existing staff and no new funding. Who benefits? Child welfare advocates and medical groups who want hard data on mental health risks. DFPS leadership, which avoids costly new data systems. And lawmakers who can show progress on transparency without raising the budget. Who pays the price? Foster youth who remain statistics until late reports are released. Caseworkers stretched thin without new resources. And lawmakers and Texans who get delayed information on a life or death issue. Why this matters. When data comes almost a year after the fact, it's too late to prevent tragedies. Foster youth face some of the highest suicide risks in the state. Without real-time oversight, warning signs stay buried in bureaucracy. Transparency delayed can mean accountability denied. Questions you can ask your lawmakers. Why rely on slow Medicaid claims instead of a faster, more direct reporting system? What safeguards exist to make sure that the data is accurate and complete? And shouldn't suicide data for foster youth be treated with the same urgency as child deaths? Bottom line, House Bill 2809 shines light on a hidden crisis, but only after the damage is done.